trying to get marijuana legalized here in California. He wants to legalize it. I believe his campaign slogan is change we can breathe in.
Change we can breathe. At the end of Craig's piece yesterday on that Oaksterdam, that the university for people showing them how to deal with the medical marijuana laws, the labyrinth there, I made a crack about how easy it was for Californians to get a prescription for medical marijuana and that they should just legalize it and forget the hypocrisy. But how easy, rather, is it really? Craig found out.
Geraldo, Proposition 215 allows doctors to recommend the use of medical marijuana to their patients. Dr. Frank Lucido is one of those doctors. Tell me about use and abuse of medical marijuana.
Well, cannabis is a safe and effective medicine for many illnesses. As far as abuse, that's sort of a misnomer or a drug war type of thing.
It's the biggest hurdle for marijuana advocates, the argument that pot leads to drug abuse. But to some patients here in California and elsewhere, medical marijuana works better than powerful prescription drugs.
I'm covered with arthritis, I'm in pain all the time, and it's made my life livable.
I was taking Vicodin and oxycodone, all these things I just didn't want to take because within the first week my stomach lining was just burning.
The biggest criticism is, of course, people coming in to doctors like yourself asking for these 215 cards just so they could party.
I think that happens. I think the majority of the patients that I see, though, have valid illnesses. I required them to show me the records that they've seen their doctor within the last year for the illness for which they use the cannabis.
Give me an idea about the requirements. Say I walk into your office, I got a sore shoulder, my feet hurt because I have tight shoes. Can I get medical marijuana?
I like to have the corroborating evidence that the illness is serious enough that they're going to see their doctor about it and have it evaluated.
Not all doctors have the same ethical standards, Dr. Frank claims. A local TV crew sent numerous producers to get a recommendation for cannabis using fake ailments. Only one was turned away. He was 17 years old.
Yeah, there's a number of doctors. The minority of them, but I'd say about 80% of the doctors have good standards, though.
Patients like 64-year-old Christine Caldwell say if marijuana was legal, the people who need the drug most would be able to get it.
A friend of mine, she went through chemo for breast cancer. She asked for the doctors to give her something so she could get marijuana. They refused. I gave her marijuana.
Just like your neighborhood garden center, these plants are being sold to the consumer for cultivation at home. In about 2 months, they develop buds that can be utilized for smoking or doing whatever you want to get high. Like many people her age, Christine is on a fixed income. So to offset the cost of the drug, she can buy the plant to grow her own. And having a 215 card allows her to do so without worry.
I was in my 20s when I discovered marijuana, and here I am 64, and it's like a breath of fresh air. It is a breath of fresh air. I love being legal.
And they actually give them a little kit to grow their own at home?
They give them a kit, or they give them, like the room that I was in, they have clones. They have the little plants and they have big plants, so you could buy your plants, stick it in your garden and grow it and cultivate it.
You're going to grow them on Geraldo's island?
No, not my island. But now you're a parent, you feel differently about this?
Geraldo, 3 years ago, I would be like, yeah, legalize it, but now that Luke is running around, when he's 16, I don't think I feel comfortable with him running into a candy store and buying a joint.
Yeah, but a lot of the people who are taking it...
Wait, Kimberly concurs.
I concur.
Okay. Well, a lot of people taking this, that I spoke to, they're taking it because they have chronic pain, they have illness, and it actually helps them. It's better than taking prescription drugs.
What about your 16-year-old running in and getting an Oxycontin?
No, but hopefully a doctor's going to be responsible enough and not give him the Oxycontin.
That's it for us. Thanks for watching. Good night.